everybody, it's Adam Farkas here at SECO 2018. I'm along with Dr. Crystal Brimer.
Hello.
And so today, Crystal, I want to talk to you all about dry eye. And for those of you that don't know, Crystal's in private practice in Wilmington, North Carolina, and when she started out in private practice, I don't know if you were intending to build a massive dry eye empire, but this is sort of what happened. And so, you know, I think everyone's really interested in how you did it and sort of the techniques that they can maybe also follow to try to build their practice the same way.
Empire, that's
An empire.
Gracious, Adam, gracious. It wasn't my intent, actually, and it really surprised me at how quickly it took off and it began to consume my practice.
Right.
And I look back on it and I believe I have pinpointed exactly how that happened. And it started with the diagnosis, creating the outcomes, and the patient education that's in there. So
Right.
Diagnosis, patient education, outcomes.
Right, so let's talk about that for a second. In the olden days, and I mean maybe even 20 years ago, dry eye was a mystery, right?
Yes.
You didn't really know what caused it. You really couldn't do too much about it. Now, of course, in the last 20 years, there's been kind of a revolution in understanding the disease and actually doing something about it. So maybe you could speak a little bit to that, about how you go about diagnosing it and treating it in a more systematic way than people used to.
Having a plan is key. If you don't have a plan, then it leads to inconsistent results.
Right.
So I think what frustrates doctors and patients alike is this trial and error approach.
Right.
And what we have to do is get over certain mindsets that we've had in the past, such as thinking that there's one silver bullet
Right.
that is going to do everything for every person. It just doesn't exist.
In your practice, it almost becomes mechanistic. When a patient comes in, you know exactly what you're going to do. You're going to run them through an actual algorithm to get to a diagnosis.
Exactly.
Great. All right. Well, Crystal, thanks so much for the advice, and I hope we'll continue the conversation online.